Hi, I've been working to get a process underway to review the many complaints that are coming in about family healthcare centers of San Diego on a daily basis. The first one I came across today, however, was from this summer, early June, but he made so many good points that I wanted to cover this one first. It's from Brian W. He posted on Yelp on June 7th, 2021. But I don't know the facility because he posted on the review site for Yelp for the main site, not for one of the individual clinics. One of the problems is there's so many places to complain about family healthcare centers that nobody's ever put them all in one place to see how really horrible the place is. But the points he made are great. I'll just read part of it since you can see it there. All I can say is, wow, this place is a nightmare to get anything done. The director, Chantal Tower, is in the blame game. I talked to her about issues and she told me it's their call center. Her excuse for this issue, he asks, yeah, they always have somebody else to blame for anything at family healthcare centers of San Diego. They have no concept of individual responsibility, and they seem to have set up systems that actually avoid any kind of individual responsibility or individual accountability. She goes on to say this Chantal Tovar, excuse me. I don't know if it's he or she. Pardon me for that. I should have checked before, but goes on to say that people make more on unemployment and would rather stay unemployed, making 165 a week, rather than work at their call center. That's outrageous. I mean, he even says, really? They pay less than 165 a week and work at their call center? Hell, maybe invest in people, train people, pay more than 165 a week. A good start to solve the issues, at least. From her, then her excuse would at least be they're not getting a living wage, which is, that's so true. The employees there are paid like crap. Um, People are starting to realize that, but what people don't realize is that crap goes directly to their patients, and you really get garbage care at that organization. That's not to say there's some good individuals there. Individuals can be good, groups can go bad, and this is a group that's gone bad. Um, he goes on to say, this has to be the most pathetic excuse I have ever heard from anyone that has control to fix an issue that I've ever heard in my life. What does he really do? He asks. Yeah, this is a clinic director. Um, and this is why this place never changes. They just kind of say, this is our little cash egg. We cash in on Medicare patients and we can keep this going forever. It never gets better. It never improves. They're harming people on a daily basis. And crappy management is one of the big reasons. I've at least worked alongside a lot of consulting firms, including McKinsey Incorporated, and you can travel the world and not find worse management than you find at family healthcare centers of San Diego. They're truly awful. They just don't know what they're doing. They have zero problem solving ability. The most important thing for a manager is to be able to solve problems. They have none. He closes by saying, part of her job is make sure the clinic works, and that part includes the people can get the health care they need. Or is that just asking too much of this country? It's a great question, Brian. This is a federally funded healthcare center. So this is the federal government foisting this clinic on us. I believe it's close to a scam operation now. I think it's gotten that bad. It's far worse than just a garden variety corrupt nonprofit, bordering on a criminal organization. But he's absolutely right. Somebody should do something. The complaint system is broken. That's why people are, desperately going to these sites. Everything about the system is broken. So, Brian, thank you so much for posting your opinion. I do hope you got the health care you need and deserve.